Welcome to the latest edition of Public Health Updates, covering breakthroughs in the past 2 weeks, brought to you by Lucid Quest. A new study from the Weizmann Institute of Science estimates that genetics account for about 50% of human lifespan variation, higher than previous estimates of 10 to 25%. Researchers analysed Swedish and Danish twin databases, including twins raised apart, using a novel framework to separate deaths from biological aging versus external causes. These findings may guide future longevity gene research. A WHO and IARC report finds that 37% of global cancers, about 7 million cases per year, are preventable. Tobacco, infections, and alcohol are leading drivers. Preventable cases vary by sex and region, with lung, stomach, and cervical cancers making up half of the burden. The study highlights the impact of vaccination, smoking cessation, and behavioral interventions. Researchers at Changping Laboratory and Washington University St. Louis identified the somato-cognitive action network, SCAN, as central in Parkinson's disease. SCAN, linking the motor cortex to subcortical regions, drives tremors, mobility issues, sleep, and cognitive symptoms. Targeted transcranial magnetic stimulation improved symptoms by 56% versus 22% in controls, offering a potential non-invasive therapy. In cardiology, a Phase 3 trial of oral enlicitide cut LDL cholesterol by up to 60% in over 2,900 high-risk patients on statins. Reductions were sustained over 6 months with minimal safety issues. A large cardiovascular outcomes trial is underway, and the drug could provide an oral alternative to injectable PCSK9 inhibitors. A 20-year trial of more than 2,000 adults aged 65 and older found only speed of processing brain training reduced dementia risk. Participants receiving booster sessions had about a 25% lower risk compared to controls. Memory and reasoning training offered no measurable protection, suggesting adaptive exercises are key for cognitive preservation. Analysis of over 11,000 gut microbiomes identified CAG170, a previously overlooked bacterial group, as strongly linked to health. It produces vitamin B12 and metabolizes a wide range of dietary fibers, supporting microbiome function. Lower CAG170 levels associate with dysbiosis and chronic conditions, positioning it as a biomarker and potential probiotic target. A 12-week trial from the University of Calgary found that 8-hour time-restricted feeding significantly reduced Crohn's disease activity in adults with overweight or obesity. Symptomatic activity fell 40%, abdominal discomfort decreased 50%, and visceral fat and inflammatory markers improved. Early microbiome data suggest beneficial shifts in gut bacteria, indicating timing of meals may support disease remission alongside standard therapy. Finally, a polymer-based gel delivered insulin through intact skin in diabetic mice and pigs, normalizing blood glucose within 1 to 2 hours and maintaining it for up to 12 hours. The pH-responsive polymer carries chemically linked insulin through the skin. While promising for basal glucose control, human dosing, safety, and broader protein delivery applications require further study. Stay ahead in public health research, like, share, and subscribe for our updates. Visit lqventures.com or email us at info@lqventures.com for expert healthcare consulting. See you next time.